On February 27, 2019, Representative Pramila Jayapal introduced the Medicare for All Act of 2019. This bill established a national health insurance program administered by the Department of Health and Human Services. Once Representative Jayapal read this bill on the floor, many outbreaks and confusion happened. Many citizens were either heavily for it or very against it. However, this did not stop Representative Pramila Jayapal to advocate heavily for this bill. As of right now, the United States does not have a universal healthcare program, unlike most other developed countries. And in a time of crisis, like COVID-19, it cannot help its citizens. This is why the United States should enact the Medicare for All Act of 2019. Not enacting this bill is extremely immoral for its citizens. The United States government should have one primary focus, and that focus is being able to look for the benefit for its citizens. However, not imposing this bill will allow lower income families imposing this bill will allow income and lower families to receive Medicare. According to Pramila Jayapal, House Resolution 1384, it stated, and I quote, "Today's healthcare system fails to provide quality healthcare to the right of all the people living in the United States. Nearly 30 million Americans are uninsured, and at least 40 million more cannot afford the cost of their co-paid and deductibles. The Medicare for All Act of 2019 improves and expands the overwhelmingly success and popular Medicare program so that every person in the United States has guaranteed access to healthcare with cohesive benefits. If the United States enact this bill, it would allow for citizens around the United States to benefit from this Medicare program. It also talks about how many Americans are uninsured at this moment, and many of them cannot even afford the cost for their medicines. This is very unpleasant. We are talking about millions of people on the fence of losing their own lives because they cannot receive healthcare. If the United States enacts this bill, it would allow for less discrimination. Even though it's 2020, this year has taught us many things. It has taught us that racism still exists within our own neighborhood. So it's not astounding when it's known that discrimination also exists in the Medicare field. If a colored lower class family enters the hospital, it's more suitable for discrimination versus a wealthy white family who comes into the same hospital. According to Human Rights Watch on July 28, 2018, it stated, and I quote, "Many LGBT people are refused services outright because of their sexual orientation or gender identity." And a national poll representative by LGBT people and conducted by the Center for American Progress in 2017, 8% of lesbian, gay, and bisexual respondents and 29% of transgender respondents reported that a healthcare provider have refused to see them because of their sexual orientation or gender identity in the past year, end quote. This article shows statistics of LGBT people suffering discrimination because of who they love. The LGBT community already suffered discrimination, and even now more, they're suffering more discrimination in the medical field. LGBT people are at a higher chance of catching diseases such as HPV, HIV, and AIDS. However, with the Medicare for All Act of 2019, it would be illegal for healthcare providers to reject people based on, and I quote, "the basis of race, color, national origin, age, disability, marriage status, citizen status, primary language use, genetic condition, previous or existing medical condition, religion or sex, including sex stereotyping, gender identity, sexual orientation, pregnancy, or related medical condition," end quote. This quotation is coming from House Resolution 1384 by Representative Pramila Jayapal. In the status quo, there's the freedom to discriminate against American people, and this discrimination happens regularly. But however, with the Medicare for All Act, we are ensuring a world in which every American has the right to primary health care no matter what. As of today, 14,255,535 million people. This is the number of COVID cases right now in the United States as of December 6th, 2020. This number is only continuing to rise. The spread of COVID-19 is a crisis that directly impacts with American citizens' health. Our current program in place allows the citizens to receive nothing. Our citizens are not able to receive the coverage that is needed during a pandemic. The Medicare for All Act will allow a more stable and reliable alternative to the system currently in place. As of today, employees' insurance isn't dependable, especially during time of crisis. The time of crisis right now is being COVID-19. As many of us know, this pandemic has taken our freedom, family, and friends away. It has also taken many jobs away from citizens, and currently the primary way of healthcare is through employers' jobs. According to Prio Research on January 11, 2018, on June 11, 2020, it stated, and I quote, "The COVID-19 outbreak and economic downturn engaged swelled the ranks of unemployed Americans by more than 14 million, from 6.2 million in February to 20.5 million in May 2020. As a result, the United States unemployment rate shot up 3.5% in February." End quote. This article allows us to view how unemployment is increasing and therefore taking away healthcare from many citizens. Without healthcare and in time of crisis, it would not be surprising to see many citizens dying. With Medicare for All Act of 2019, it would create a more stable health Medicare program, and it would allow a reliable source of income. The Medicare for All program, if enacted, would not go anywhere and should not be even thought about not being funded. Because according to House Resolution 1384, Pramila Jackson has stated that it has a trust fund, and I quote, "It is hereby created on the books of Treasury of the United States a trust fund to be known as the Universal Trust Fund for Medicare." Citizens are dying because of the pharmaceutical companies. These pharmaceutical companies are taking high advantage of citizens because because they know that they are needed. Citizens are emptying their wallets for the medications while the pharmaceutical companies are gaining massive income. According to Gallup in November, it stated, and I quote, "Pay for need medicine and drugs and a doctor prescribed to them." The percentage have increased significantly from 18.9% in January 2019 to 22.9% in September. And all the 22.9% represents about 58 million adults. And according to NPA, in September 2019, it stated diabetic supplies will cost $1,300 a month without insurance. Most of this is for insulin. With these two pieces of evidence, it's evident to see the pharmaceutical companies are taking high advantage of citizens. However, with the Medicare for All Act of 2019, it will be illegal for them to set prices, since the act allows the Secretary of Health and Human Services to pick the price. This is coming from House Resolution 1884, Section 616, where it states, and I quote, "The price to be paid for covered pharmaceutical Medicare comes from and should be negotiated annually by the Secretary." There's no other way to explain it other than the United States should enact this bill to benefit its citizens. If the United States does not, it is immoral and it is being selfish to its citizens. At a time of crisis, that being COVID-19, many citizens are facing discrimination. These pharmaceutical companies are killing and murdering citizens because they are trying to profit themselves over human lives. Is equality that controversial? It is unfair to see many citizens 6 feet under for something that can be avoided. It is time to start caring for others.